One of the most important procedures that I'm proud to offer my patients is the safe mercury amalgam removal technique, or SMART. Amalgam fillings, also known as silver fillings, contain large amounts of mercury. For some patients, these fillings can be particularly harmful, especially when these fillings release mercury vapors inside the warm, wet environment of the mouth. Another issue with these fillings are when they need to be replaced or when the patient needs a crown. This, in fact, is the most dangerous procedure for a patient because a large amount of toxic mercury vapors are released when these amalgam fillings are removed. In our practice, we specialize in the safe mercury amalgam removal technique, also known as SMART. This technique, supported by the International Academy of Oral Medicine and Toxicology, is the safest and most documented procedure to safely remove amalgam fillings. In our office, when we perform the SMART protocol, we first start by making sure that the patient is properly protected by putting a barrier over them and eyewear as well as a safety bonnet on their head. We then make sure that they're connected to an external oxygen source so that when these mercury vapors are removed, the patient is able to breathe pure oxygen and stay protected. A rubber dam is placed specifically over the patient's tooth in order to ensure that the mercury particles are safely collected. There are proper filtration systems installed in every room in order to help filtrate the air. Finally, we make sure that the patient has a charcoal rinse at the end of the procedure to ensure that any stray mercury particles are properly bound and out of the patient's body. After safely and carefully removing the amalgam restoration from the patient's mouth, we replace it with a biocompatible material.